Good afternoon. It's noon in the Triad, and that means it's time for Empowering You. I'm Alvin Atkinson, and it is my pleasure each and every Sunday around noon to welcome you to a program that is all about you. It's the fourth Sunday in May, which is typically our Forsyth County Government Day, but it's also Memorial Day weekend. So we're glad to have you join us, and we're especially proud to have our first guest today, Miss Denise Price, who is the Deputy County Manager and the Health and Human Services Director. Good afternoon, Denise.
Good afternoon.
So we were just saying we hadn't met in person, but now we're in the flesh, and we're on the radio. So we're doing a double take today. What I want to ask you about, Denise, is that you actually have now moved a lot of your departments to a place you call the campus. Tell us about that move. What was the reason that you wanted to consolidate?
Sure. So our Health and Human Services campus is on Highland Avenue. And on that campus is social services and public health, and what we refer to as Annex 1. There's also another very special building on that campus. We call it the Highland Avenue Center. And what that is, or what is envisioned to be, is a one-stop shop for individuals with behavioral health needs. So to have a more robust continuum on that site and to have more of our behavioral health services department in that space really means for our residents and our customers that they have more opportunity to have their whole person needs met.
Well, speaking of the whole person, a couple of weeks, in fact, last month, we had a couple of your colleagues, Mr. Al Thomas and Christine Evans from the Stepping Up program, talking about that program. But there were other aspects from the pharmacy, peer support, and mobile integrated health. Tell us about those program services, because those are the programs that are actually touching individuals.
I would be delighted to. So Forsyth County for a number of years has had a lot of services and supports that they offer for individuals related to behavioral health needs. We now are in a single department, Behavioral Health Services. That has been the case for a couple of years now. And the other departments that you mentioned, other sections, are part of Behavioral Health Services. So you met Al and Christine, and they're phenomenal and have a great program, Stepping Up, and I know you've learned about that. But we also have a retail pharmacy that Forsyth County operates. It's a traditional retail pharmacy in that anyone can visit it, but it's a limited formulary. What does that mean? It means we don't carry all medications. We primarily dispense behavioral health medications, and while we're traditional retail, we're a little bit different in that we charge individuals for medications what we pay for them. So we accept insurance. We're reimbursed through Medicare, Medicaid, Blue Cross Blue Shield, and others. But if you're paying cash, we don't upcharge on your medications except for a very small dispensing fee. We're a little bit different also in that we have a full-time patient assistance program person who can help people to enroll in manufacturers' programs to receive no and low-cost medications if they qualify. So we really are trying to get people to adhere to medications and not have barriers to accessing them.
Wow. So that's news, and I'm hopeful that our listeners are hearing this, that a pharmacy is there on the East Campus. And another program that you have is the substance use prevention education. Tell us a little about that.
Sure. So we do lots of educations around substance use that can be talking to church groups or to business groups or to children's groups, anyone really who wants to know more. Having conversations breaks down stigma. We provide training on how to utilize Narcan or naloxone and opioid reversal medication. We also provide that medication at no cost. So lots of resources in that space, connection to treatment providers. Reach out if there is a need for a group that you're involved in, or if you're just an individual who wants to know more.
Yeah. And how do you contact the department?
Yeah, absolutely. So you can call our main number here at Forsyth County, or you can call Denise Price and she'll get you connected. Right. My direct number, and I'm happy to say this online and hope that folks will reach out, is 336 703-2781. And there's also a great website you can go to get individual program numbers. That's forsyth.cc.
Okay, now, when I've been in this city a long time, and I almost got confused a little bit when you really operate a consolidated department or a service provider, and that whole aspect of having health and human services and social service. Tell us about that consolidation. What is, because you got a long name in your title.
We do. So we are a consolidated health and human services. That really just has to do with how we are organizationally structured. So our consolidated entities are behavioral health services, social services, public health, and Bridges to Hope, our Family Justice Center. For a resident, what does that mean? It really means that you should be able to walk into any of our buildings and get connected to other areas of support and services that you may need or want to access. Being consolidated allows us to work better together for the resident.
So we're on the campus. You're calling it downtown too, because it really is downtown. And how long? When did you start doing this?
So we started doing some renovations a couple of years ago, a little bit beyond the COVID years, and it's turned into such a beautiful space. What residents should begin to see now is an area in beauty that mirrors the excellence of service that they can expect to receive. For many of us, and myself included, when we're in a crisis, we don't necessarily know where to go. So I'll equate this to if I'm having chest pains. Well, who do I go and who do I call? Do I call my primary care provider? Well, what if I don't have a primary care provider? Do I go to the emergency room or do I go to an urgent care? It's all very confusing. So, especially in terms of behavioral health services, what we want people to know is that they can come to this Highland Avenue Center at 650 Highland Avenue, walk through the door, and let us help you to figure out where you need to go and what services you need. Oftentimes, an emergency room is not needed. And when I think of emergency rooms, I think of bright lights and lots of people that are in crisis, lots of trauma. And if I'm having my own crisis and my own trauma, it doesn't help me to be surrounded by others. Now, emergency rooms have their place, don't get me wrong. But if we can go to a place that's trauma-informed and calm and get the level of care that we need, that's the best place for us.
Absolutely. And I'm just amazed at how you're able to keep up with all of the consolidation and the work that's going on. But I understand also there may be some other additions or things happening at the park. Is there something about an auditorium? What is that about?
So we have a newly renovated auditorium. It is at 725 Highland Avenue. It's absolutely beautiful. It seats 125, and it's a space where we can begin to integrate health and wellness, because those two things are very connected, very connected. I think of the things that I do when I'm stressed out, and it usually involves listening to music. We talked about your jazz music.
Absolutely.
That might be what I do.
Right.
Or I go see a movie. So beginning to integrate those two places. We also have a beautiful new park. Great playground equipment that is accessible for wheelchairs. You do not have to come out of a wheelchair to get onto a swing. So we want people to come in, enjoy these spaces, get comfortable on our campus, and access supports and services.
Well, I think one of the things, too, is, being a longtime resident, we always hear about Highway 52 and the divide. And I just want you to speak a little bit about how intentionality with this park is so critical to what we're doing here in our county.
Absolutely. You will notice that campus is wide open, and that is very intentional, and we hope also very symbolic for our community. If you've been over to the campus lately and you've been over to the Annex 1, kind of in between that space of the park and social services, and you back up to Malloy Jordan Library, which is another beautiful resource in our community, you might have noticed that there was a barrier there, like a physical barrier to keep cars from moving back and forth. That barrier's gone, and what we hope is that is symbolic of barriers being broken down, because it is very much the intent. We want folks to be very comfortable on our campus and to feel comfortable coming in and saying, here's where I'm at and I'm not real sure where to go.
Well, I definitely am appreciative of that decision and of the consolidation of the programs and services. And thank you for really bringing a smile and starting us off today here on Empowering You.
Thank you so much for having me.